Welcome to the Fusionary Health podcast, where we discuss all things health, wellness, well-being, and we learn from the most amazing practitioners and people in the space of health and wellness. Welcome today. I have an incredible guest, Dr. Stephen Gorin, down in Miami. He's an orthopedic surgeon. I've known him for years, and I've always been incredibly impressed with his work, how he works with his patients. I've met so many of his patients who are incredibly pleased with him and how he does things. So welcome, Dr. Gorin.
Thank you, Shivani. Thank you for that wonderful introduction.
So will you share with everyone a little bit more about yourself, your background, your education, and why you got into orthopedics?
So interesting enough, my background as an orthopedic surgeon didn't start until my fourth year in medical school, where my entire life I thought I was going to be a cardiologist. My father's a cardiologist, and I thought I was going to follow in his footsteps from childhood.
Okay.
And but I was always into sports. You know, I didn't get into medical school immediately after undergrad. You know, not everybody gets in immediately. So I did a master's in sports medicine, athletic training. So I got to learn anatomy and how the body really functions in a different format there. And then got into medical school and actually went to DO school at Nova Southeastern. And while I was there, still continued to think I was going to be a cardiologist. Studied it all the way through. And then on your third and fourth years, we typically do rotations. And on my fourth year, I did a rotation in orthopedics and I did a rotation in cardiology. And that's where my confusion began.
Okay.
Because my whole life, I thought I was going to do cardiology. My plan was to do cardiology, go into practice with my dad, and just go in that route. So I did the cardiology, did orthopedics, went to my dad and said, you know what? I'm really confused. And he said, what do you mean? I said, I really, really like cardiology, but I really, really like orthopedics. And he gave me probably the best advice that you could ever get. And he said, look, most importantly, you have to do what makes you happy. Don't make me happy, because whatever happens in the future, if you're upset and annoyed, you're going to be annoyed at me for the rest of your life if you decide to do cardiology because of me, not because of the medicine.
Totally.
So you have to choose what you like. And it took a few months of going back and forth in my own mind, trying to figure out where I wanted to be and what I wanted to do. And I chose orthopedics. Okay. And a lot of his colleagues called me a schmuck.
Really?
Yeah. They said, what are you doing? I mean, your father has a very successful practice. Why aren't you going that route? And I told him what he said. And he said, well, we can't argue with that. So they wished me luck once I got into a internship and then residency afterwards.
Amazing. Yeah. And you went down that whole path, went into orthopedics. Are you happy with your decision?
I'm very happy with my decision.
Awesome.
Yeah, because it's definitely a world. The reason why I liked orthopedics, besides the fact of not having to be in the office every day,
sure,
was I can directly affect somebody's healthcare. And sure. I can directly help someone. And with my background with athletic training, it gives me, and the osteopathic medical school, it gave me a little bit better understanding of how the body works and anatomy. So I thought that would work better than I'm hoping that patients would take their medicines and hoping that they would take their blood pressure pills and make sure that they stay controlled, because you don't have a lot of control with that.
Sure.
So if I can directly affect them and teach them, I felt that would be a better route for me.
Sure. So let's discuss this, because as someone who's been in the field of talking to doctors for about 7 years now with the products that I created, I'm curious. This is my experience. Is DO doctors are a little different than MD doctors.
Correct.
And I love both. I think they're all awesome, but it's just different mindsets. It's different approaches. So can you share that with us a little bit? Your approach as a DO orthopedic and how that's different than MD or some of these other areas.
Okay, sure. I can give you the basic understanding the differences of traditional MD or allopathic medicine and DO or osteopathic medicine. And in the osteopathic world, we're taught a lot more of a holistic approach to the body and how the body functions. So a patient typically, at least when we were in medical school, wasn't just an arm. They weren't just a disease process. It was the whole body. And we had to learn how to examine the whole body and see how patients feel and what's going on with them as far as whatever pathology, whether it was orthopedic or rheumatological or endocrinological. We were taught to look at the whole body. And typically in allopathic, you're disease focused. You're focusing on what the problem is, focus on that, but kind of with blinders. And I know in allopathic schools more recently, they're starting to teach more of that philosophy.
Sure.
But back when I was in medical school, it was completely different.
Hmm.
And most people really didn't understand the differences between DO and MD because they just didn't understand. And in all reality, we got exactly the same medical schooling as an MD. Plus, we had the osteopathic, which was more of a holistic approach, evaluation of the body, manual treatment, and really understanding better. So it was actually an MD plus training, but didn't have the significance. And there were a lot of places that still didn't allow DOs into the hospitals at that time.
Wow.
And now it's become more open.
Yeah. And I recently told someone on my team, I was like, yeah, there's DO, ortho, and MD. And they were like, what? What's a DO? I was like, how do you not know what a DO is? It's the exact same thing. It's just a different mindset.
It's just a little different mindset. And really, when I did my orthopedic residency, we trained alongside MD residents and did exactly the same surgeries. We studied exactly the same things. And when we take our first set of boards, it was really funny because, you have to become board certified.
Right.
And in the board certification exam, there's hundreds of questions. One osteopathic question, which is pretty much the last question which any DO that went to DO medical school could answer.
Yeah.
But the rest was the same thing you'd see in an allopathic exam.
Okay.
So essentially, the DOs are trained exactly the same,
right,
but just with a different mindset than MDs. And it's just a little bit different philosophy. No one's right, no one's wrong. It works for some. Some ways works for some works for others.
Right.
I enjoy the osteopathic, and the more I learned, because I didn't even know much about it when I first started, but I understood more, and I think my patients see a difference in my approach with them because of that background.
Sure. So let's talk about your practice a little bit. When it comes to working with patients, what are some of the favorite things you have to work on? What are some of the specialties that you focus on within your practice with your patients? And what are some of the novel approaches or unique or different things that you do with patients that make you stand out?
So I run a typical general orthopedic practice because one of the things that my father taught me, even though he's a cardiologist, he still sees people that have colds and people that have aches here and pains there, because at the end of the day, you're still a physician.
Sure.
So I don't focus on just one body part. A lot of orthopedists are like, all right, this is all I do.
Yeah, a lot of them are knees only.
That's all I see.
Knee and hip only. Yeah. I won't touch your hand. I won't touch your ankle.
Exactly. So I see everything. I see from head to toe. Doesn't mean that I do surgery on everything. I'd like to tend to do more sports-related, joint-related procedures, but I see everything from back pain to plantar fasciitis. I mean, you name it, and I see it. And the beauty of being in practice and growing up in this region, I've been able to develop a network of physicians that I trust. Okay. So I also try to act as a gatekeeper for some patients.
Sure.
And I often tell primary care physicians, if you don't know what's going on, send them to me. I'll figure it out. And if I can't fix it, I at least know somebody that can.
Correct.
And that's been through trial and tribulation. Sometimes you get some good ones, sometimes you don't.
Yeah.
So, but I've been able to find a good network of physicians that I know will give patients a good outcome.
Good.
So, but most of what I do is knees and shoulders, more sports stuff.
Okay.
And that's in either the arthroscopy or total joints. But the majority of what I do is conservative.
Sure.
A lot more of my patients are treated conservatively than anything else.
Sure. And that's another thing is orthopedics has this rep of if you go to ortho, they're going to tell you need surgery. They're going to tell you have to be cut open. And I had that opinion too before. And when I created my supplement Fusionary, I thought, okay, well, I'm just going to give orthopedics this tool because they're always trying to cut us open. And once I've gotten to know you guys so well, guys and gals, I know some gal orthos as well. That's not the case. It seems like 90% of what you do is conservative care. Like, how do I help you get out of having aches and pains or having those arthritic issues? And only last resort is that joint replacement or that more serious surgery.
Yeah, I often have that discussion with patients, and there are those guys out there and those girls out there that they will do surgery cut first, ask questions later.
Yeah,
and there still is that old school mentality, but I think as society's changing, people are changing, and they're looking for alternatives. Can't be surgery always first,
sure.
And oftentimes I joke with the patients and I tell them to stop asking for surgery.
Really?
I'm not offering it. I never offered it. So why bring up surgery?
Yeah.
So because we live with pathology. If you think about the way the world was even 100 years ago, people probably had a lot of the pathologies that we see today, but the majority of them never even sought out any intervention.
Sure.
So we can live a long time with certain pathologies. It's when it becomes irritating and uncomfortable that we change. That's when we need to intervene.
Right.
And there's a lot of different interventions that we can do. So it's not always surgical. There's a lot of different ways to treat it.
Sure. And I always see you when I've met with you, you're always you're always looking at new technologies like wearable shirts and helmets. And every time I've talked to you, you're into finding new, novel, different things that can support the athlete or can support us in prevention. So can you talk about any of those things that you've gotten into? Or even I heard you say once, when I do surgery, I do this patch in there and this thing. So right when they walk out, they're functional and moving. They've got less pain for the first 3 days. It always sounds like you're not experimenting, but you're investigating and utilizing the newest and best so people can be back to life fast.
Yeah. And a lot of the approach is you want to stay ahead of the curve, but you don't want to be at the front of the curve because that's where mistakes happen. You want to stay ahead of the curve because you don't want to be left behind. And it's always important to keep evolving, in every aspect of life. So even in medicine, we have to keep evolving in what we see and what we do, because we always say, and we were taught, if you're still doing things today the way you were trained, well, the technology's changed. I mean, I finished residency about 17 years ago.
Okay.
Things have evolved a ton since then. And there's a lot of new ways to treat pathology and treat different issues, whether it's the knee, the shoulder, the ankle, the wrist, anywhere, And some of those things, like you said, one of the things that I like is trying to prevent issues.
Sure.
And that's where this, wearable shirt that reminds you how to sit appropriately, gives you a better posture.
Right.
It's not a brace. And oftentimes people will say, can I wear a brace? And yes, but it'll weaken you.
Sure.
So you don't want to be weak. You want to be strong. So we have to find things that help. In surgery, there's different techniques that we're starting to use that help speed up the recovery, and new technologies that we can use in surgery to limit pain, because especially the pain pathway, that's the biggest thing. And, there's been a huge opioid crisis in the country, and we won't get into how that began. That's a whole different discussion.
Yeah.
But we're in it, and we have to find alternatives to treating it. And that's why we look at different philosophies, because nobody has 100%. If there was only one way to do things, there'd only be one way to do things.
True.
But there's not one perfect. So we try to find alternatives, different regimens that'll help alleviate, get people moving quicker.
Sure.
It's really funny when I do surgery, what I call a simple surgery, knee scope, clean out a meniscus tear, small tears or whatever. And patients are thinking, well, I'm going to be out. I won't be able to do things for weeks.
Right.
Oh no, you're up and walking the same day out of surgery. I mean, we do techniques. We help prevent pain in different formats, whether it's injections or units that'll help alleviate, TENS units, which are wearable devices that'll help diminish pain, the pain pathway, where you limit the number of narcotics. So it's trying to get away from the narcotics, and it's a great adjunct. Unfortunately, oftentimes insurance companies won't cover some of those things.
Sure.
Because they, for whatever reason, would rather us give the pills to alleviate the pain rather than something different.
Sure. And maybe they'll catch up.
Hopefully so. I hope at some point they will.
Yeah. And I think the pandemic definitely changed people's mindsets. From what I saw, I'm the creator of Fusionary, and the turmeric supplements I created, people were into it. And pandemic happened, and all of a sudden people were like, wait a minute, I want a lot less narcotics and drugs. I really want that natural alternative. So since you mentioned alternatives, will you talk a little bit about Fusionary and your experience with it and your practice, and kind of what that patient mindset is around, actually, I am willing to commit to a natural solution as opposed to taking stuff with side effects?
Yeah, I can say for sure in the last about 10 years, I've seen a shift in patients' behavior, and they don't want to, either they're young and they don't want to get on pills, and they want an alternative, something natural and more norm than pills, or they're older patients who already take a ton of pills and don't want to add another pill to their selection and then have to deal with the side effects of that pill.
Sure.
So the idea of supplements in the natural format have been very helpful. And that's where, to me, Fusionary came in as a great adjunct to help alleviate inflammation and pain with all different kinds of patients, from younger patients to older patients. I think it's definitely a great way to alleviate it. And as I often tell patients, there's not a lot of side effects.
Yeah.
And they often say, well, I buy this here and there. And I go, look, it's unfortunately it's an unregulated world, so it's difficult. So when they ask me if what they get at the drugstore is good, I tell them, look, I can't tell you what isn't good, but I can tell you what is good. Right. And that's where I talk about Fusionary, because I think as you've developed this brand that really helps patients in a proper way. And I think that's the important part, because if you're just buying anything over the counter, you don't know what you're getting. You know, it's a roll of the dice.
True. It very much is.
Mm-hmm.
Can you share with us some of your favorite patient stories over the years? Any that really stand out? It's always fun to hear from you when I talk to you about, like, you know, I used this on this patient and I got this result, or I had this tennis player. I know you have patients who are paddleboarding from Bimini to here for charity. So you meet some really cool people along the way. Do you have any standout stories you can share with us that kind of highlight how your approach with them has been different or unique, or really helped them on their journey? Yeah,
I mean, just like you mentioned, I have this one patient, she paddles from Miami to Bimini for a charity event. And same thing, did not want to be on pills and stuff, but didn't mind taking a supplement. And that's helped alleviate. That's a long way to go on a paddleboard.
I know.
And that's definitely helped her. I've had tennis players, and I've had just your older patient with back pain who's tired of taking pills and they want the alternative.
Sure.
And put them usually on the turmeric, because I think that helps them the best. And they've enjoyed taking it. Nice. And there, sometimes some people, look, doesn't work for everybody, but neither do the over-the-counter meds.
True.
So everybody's different. So it'll work with some, won't work with others. But I think the patients are happy because it's not a pill. It's an alternative.
Sure.
And they like that. They like the concept of, look, I'm not taking any more medications. It's not going to shoot up my blood pressure, which a lot of the NSAIDs do that. You know, and then they can't take that medicine.
Right.
And so it's been very, very successful.
Nice.
Yeah.
Awesome. Very cool. Any fun patient stories recently? I know a lot of my orthos are like, you know, I had this golfer. I was able to do this surgery on his knees. Then he could still play golf for 10 years, or runners. I always love hearing those stories, because I think, like I said at the beginning, we always assume in orthopedics, like, I'm going to get surgery and then I'll never be able to use that thing again. Like, I need a bunion surgery, and I've been told, don't do it.
Correct.
You'll regret it. It's not worth doing. So it's almost like I want to hear the opposite of that, of, hey, I got my knee done and now I've got 20 more years to use that in a great way.
Yeah. I mean, I've had many patients like that. And it's ironic. I've got two friends of mine that I grew up with, a little bit older. We played sports all throughout our childhood, throughout even to our 40s. We were playing sports together, and both of them limping around and didn't want to have surgery. They tried every alternative.
Yeah.
And finally one of them said, all right, I'm doing this. And underwent the arthroscopy, and he called me up the next day and was like, why didn't I listen to you earlier?
Yeah.
I should have done this sooner. Because, you know, he was one that failed conservative treatment. We tried everything else, and all of a sudden he's back to being active, getting on his bike, doing Peloton, doing everything that he can.
Nice.
With no pain. Another friend of mine who suffered through his daughter's wedding, and because he wanted to postpone, and even told me he didn't get to enjoy it as much as he could have.
Right.
Did his surgery. 2 weeks later, he comes in, we talk, and he's like, I should have done this sooner. He's like, I would have been able to enjoy my daughter's wedding.
Sure.
Would have been able to dance more, but I just was scared.
Right.
And he tried to go see one of the big name physicians in town. And because he wasn't on a roster, on a team, he couldn't get in. And that's often for us community guys, you know, we're fighting the big name, big team doctors.
Sure.
And those guys are great. I know a lot of them, but a lot of us are just as well trained and can do just as good a job,
right,
and have alternative views.
Sure.
You know,
I've seen that a lot, actually, is we assume big name means great. And it actually really comes down to the person, the training, how well we're going to work together, the physician-patient relationship, who you vibe with, who you trust, how much volume they've done in what they're doing. Like, are they out there on a speaking circuit being famous? Or are they right here doing a volume where this is what they do day in and day out?
Correct.
Yeah.
And I mean, so there's those guys that do a lot, but they also have a big team behind them
Sure.
Lots of fellows, lots of residents
Sure.
that are working with them. But then as community guys, look, oftentimes just us and maybe us and a PA,
Yeah.
if they have one,
True.
and that's it. I mean, there's nobody else.
True.
So we have to keep evolving. We have to keep working on our craft.
Sure.
Because it's like I said earlier, if you stop learning and you don't evolve, that's where issues happen.
And I also think you get bored. You know, I've hung out with enough practitioners to now understand that everyone has their lane, and the way medicine has progressed, that lane kind of narrows down to orthopedics does A, B, and C, A, B, and C again and again. And so even in my profession, I'm in the supplement sector. My job is A, B, C. And if you're a creative person, you want to kind of jump out of that box and jump out of that lane pretty often. So you have to have your own side projects of interest.
Correct.
And that's what I've seen you do is you're always like, okay, you know, I think I'm going to get into this thing and recommend this to my patients. You're constantly looking for the new things that'll support the patient. And that keeps it interesting.
Yeah, because otherwise it would be the monotony of doing the same thing over and over. And and a lot of us get stuck in our lane. And as time goes on and as you get further on in your practice, you get more comfortable just doing certain things. And that's why I said earlier, I've got a network of physicians that I work with that, all right, I don't feel comfortable doing that anymore. Yeah. But I've got guys that do it. And I look for alternative treatments. And I've learned a lot over the years. I would say probably my athletic training background and opened up a lot of doors.
Sure.
So I've learned from massage therapists. I've learned from physical therapists. You know, as much as I like teaching them, I learn as much from them. Nice. Because there's a lot of things that I just don't have time to learn. They have their segment of the world. Sure. I've got my segment. So I bring in what I learn and I teach them, and then they teach me as well. And I incorporate it into what I do. Yeah. So it's very helpful.
Perfect. Yeah. And I've seen a lot of times with your patients, because I hear from them all the time. I hear from them like, Dr. Gorin's amazing. You know, the patient we're talking about who does the Bimini track, she's like, I can use my shoulders. I'm not as sore. He keeps me in the game. And I think that's a big deal. You spoke into how, you know, people are so scared to get the surgery. And I've seen that too. My own father-in-law waited 10 years. He was trying physical therapy and a couple different things. But when I met him, he was just couch ridden. He wasn't getting off the couch. He was just watching TV all day because it hurt too much to move around. And so can you speak into a little bit of the fact that in orthopedics, you guys have robotics now. You have so many options that get people, you do the partial knee, like you have ways to get the patient out and running. And you don't have to wait all that time of suffering until the very end game where it's like a total something replacement, knee replacement. And thus it is a painful couple of weeks of recovery. And then they get to be more functional again.
Yeah. Oftentimes, you know, back when we were training, that knee replacements would only last 5 to 10 years. And it wasn't really the metal that we put in, it was the plastic. And as things have evolved, the plastics have gotten better. So they're a lot stronger. And they're lasting longer. And, you know, that's where the sports surgeon and the joint surgeon, we kind of differ, where a sports surgeon, we might recommend a partial knee replacement, which means we only replace one part of the knee rather than a full knee replacement, especially in a young person. Sure. And that allows them to get out and be active a lot sooner. It's definitely less painful instead of doing a full knee replacement, which is a painful procedure. And oftentimes, like your father-in-law, that patients wait too long. Right. I just had a patient, I first saw him 16 years ago, and he said, yeah, I'm going to have it done. 16 years later, we did his knee replacement, and he felt so much better. He said, why didn't I do this 16 years ago? Yeah. And good thing for him was, like you said, things have evolved. With his surgery, I actually use a computer-assisted device in surgery to make sure that the implant goes in appropriately. Perfect. You know, there's computer navigation that some physicians use. I use another system where we pre-navigate by getting a CT scan of the knee, and we get customized cutting guides that are made for the patient.
I've seen that.
Yeah. And then even for my partials, I think it's even cooler. We get customized implants. There's only one company out there that actually makes a custom implant for the knee, and they make a partial, they make a total. You can't take that one and put it in anybody else because it's perfectly designed for that person's knee.
That's amazing.
And that's just the newer technology that we didn't have that stuff 15 years ago.
Custom knees.
Completely customized knee replacement.
And custom cuts for the surgeon. So it's custom ready before you do the procedure.
A lot less blood loss. Yeah. There's a lot better fit. You know exactly what size you need to put in, because when we go to surgery, typically we use generic sizes, 1, 2, 3, 4, 5, 6,
Right.
with different size, and we put whatever's in. With the newer technology, we know exactly what's going to be the optimal size
Sure.
because the scans will show us and tell us exactly what fits appropriately for each patient. And that's just in knee replacements.
Yeah.
We have similar things that we're doing in shoulders, where customized guides to make sure you put the socket in the right spot. So, and they're starting to work on that in the hips as well.
Got it. So what I'm hearing is we inevitably through life, maybe through lots of sports when we're younger or an injury that comes along, end up creating pain. And a lot of us, I'm very natural and holistic. A lot of us, and I've moved more towards the line in the middle after meeting so many practitioners like you. I'm so natural and holistic. I'll try every single door to avoid an intervention that I consider medical or Western. So I'll try, any issue I have, homeopathic, naturopathic, Ayurvedic, chiropractic, medical massage, acupuncture. I will go down a long line. But what I've learned is if you find the right practitioner and you find someone who you can really partner with in your care and health, someone who listens to you, then you learn about this whole other side. Yeah, it's medical interventions, but there's so much great modern science and technology that's been created to support us. And even though I've had surgeries now in the last couple of years, when I have a surgery, I prepare for 6 months. So I am my healthiest and strongest. Post-op, I have an entire Ayurvedic gut healing plan in place. So although the intervention was medical and involved some drugs and painkillers and antibiotics and those things, at least because I'm partnered with my doctor, we have a plan in place to get me back to as healthy and strong as before. And so I think that that's where you're so unique is you're saying, I want my patients to be functional for longer. I'm in sports orthopedics. I'm willing to recommend a partial knees or a partial anything much earlier because I know that they can gain more function and quality of life. And to me, that quality of life is a big deal because I see people like my mom, like my father-in-law, who just wait too long. And once they're that sedentary, moving into their older age, the habit stays.
Correct.
Despite the knees changing.
Yeah.
And that to me is very frustrating because that obesity that comes on, those other issues all lead to much further health issues. And they could have just as easily 10 years earlier made a different choice that would have changed the entire trajectory of their health.
100%. And I often have that discussion with patients and I'll tell them, look, if I do knee replacement, it's not to get you to sit back on the couch.
Correct.
The purpose of a knee replacement is to get you out of pain, to be active, to enjoy life with your grandchildren, with your children, because we're starting to do these in younger patients. I've got many 40-year-olds, patients in their 40s, early 50s, that had just destroyed their knees when they were younger. Sure. And there's no other alternative that we have. But the point of it is to get them to be active.
Right.
And to undergo such a large procedure and not be active afterwards makes no sense.
Right. And if it can last 20 years.
And they're lasting 20, 30 years.
Wow.
So if you have a knee replacement in your 60s, if it lasts into your 90s,
right?
I mean, especially the way people are going today, it'll last for, pretty much forever.
Right.
But before you'd have to go under multiple revisions because just the plastic didn't last long enough.
Right. So it used to be recommended so much later. Now it's okay earlier because of its longevity.
Yeah.
And because of its longevity, you can have that function for that much longer.
Yeah. The function is the most important thing.
Yeah.
And oftentimes I'll say in my office, half of my work is psychiatric. It's not even orthopedic.
It's true.
And half the stuff that I talk to patients about has nothing to do with what's going on. It's really trying to motivate them to get better because, as much as I can intervene, if they don't do any intervention, it's worthless.
Correct.
So a lot of times, especially with my sports patients, I try to prehabilitate them before we go through surgery, just like you did. Yeah. Get their bodies in an optimal position, an optimal shape. So once they undergo the surgery, the recovery will be easier.
Sure.
And I've had a few patients who've said to me, you know what, I should have listened to you. I should have done my prehab first and then done the surgery because it wasn't an emergent surgery. It was elective and they could have had a better outcome initially. In the long term, they had a good one, but just took them a little bit longer than everybody else.
Sure. Yeah. And that's a big deal is the planning.
You have to plan for everybody.
Yeah.
Yeah.
Oh, that's wonderful. Cool. Well, I've loved talking to you today on this episode. I'm so glad we got to dive into how in orthopedics we can really bring in preventive medicine. We can plan for our health in a different way. We can look at conservative care, But also look at an intervention as one that's for function, one that's for quality of life, not something to shy away of or be scared of. Like really looking at your orthopedic care, your joints, your joint health as something that you preventively can approach instead of shying away and being scared of going to your orthopedic doctor down the street who can help you.
Yeah, and a lot of times, at least I can say in my practice, it's funny because I have a conversation and then I have the same conversation I have in the office and I do with friends outside the office when they start to complain about aches and pains. And I would say maybe 75% of those patients are just stiff because they don't move enough. Or even if they move enough, they don't stretch.
Wow.
And they don't stretch appropriately. I had this conversation with trainers, with therapists. And then when I examine them, I show them what's wrong and they go, oh. And many times I've had patients who've come in and like, you know what? I was a very big skeptic. I didn't believe in physical therapy. I didn't believe in it working.
Sure.
And once they went through it, they're like, oh my God, why didn't I do this like 5 years ago?
Wow.
Because they just sit there and suffer in pain. They take some pills and the pain goes away.
Sure.
But then it comes right back.
Of course.
And then and sometimes they seek alternative treatments. And just like I said with orthopedics, there's alternative treatments that work and others that don't work. And it all depends, you know, and if you don't, sometimes you have to change it.
Yeah.
Change facilities. I had one patient once who said to me that she loves her chiropractor. I said, great. Gets me out of pain. How long have you been going to the chiropractor? Well, I've been going about 7 years, 3 times a week. I said, do you think after 7 years, this would have, you'd be fixed by now?
Yeah. Yeah.
I said, obviously it's not working. I go, yeah, they do a great job initially,
Right.
but there's more to it than just the manipulation, which is also the things that we learn in osteopathic school. We learn the exact same manipulations as they do as chiropractors. We learn some of the same treatments that the physical therapist does. That's what gives us a little better understanding of how the body functions.
Sure.
So it was pretty interesting when that person, the light bulb came on and they're like, oh, maybe I should change.
Yeah.
Yeah.
Yeah. And that you're right. A lot of medicine now is psychology. A lot of medicine is looking at what is it that the patient needs to understand to create the shift.
Yeah.
When I work with my clients, that's what I'm looking for. I'm just trying to ascertain as quickly as I can, what is that one button that if we just press that button and create that shift, everything else will shift.
Yeah. And even nowadays, I'm able to talk to patients about weight loss.
Good.
And oftentimes what I tell them, because I went through an issue for years trying to lose weight. And it's a mind shift. If you don't change your mindset, doesn't matter what diet, what program you do. And in orthopedics, it's important to be able to change your mindset because weight has so much to do with how your joints and how your muscles and how your tendons respond to everything. And it's often a mind shift. It doesn't matter what pill, what you inject yourself with. If you don't alter the way you think about food, the way you approach life, nothing's going to work.
It's true.
You know,
it's true. Whenever I've had knee pain, plantar fasciitis, I get told very clearly by orthopedics, it's 10 pounds. That's what that is. And it's true. I can see it in myself. Whenever I see plantar fasciitis come up, I'm like, oh, we know what we have to do. I know the homework.
Yeah, that's part of the homework. And part of it is like I talk about flexibility.
Right.
Oftentimes people think, they're like, oh, I walk every day. Well, so does the majority of the world.
Sure. Do you stretch? Do you move the body in the way that it needs to move?
Correct.
For it to be stretched.
That's why some of my favorite conversations are with some personal trainers because they say, oh, I train every day. I'm training my clients every day. Yes, but are you work on your flexibility? Do you work with your clients' flexibility? Right. And they don't.
Of course.
And that's I think my biggest pet peeve in the musculoskeletal world.
Sure.
Because people just don't work on flexibility.
I agree with you. I go to a gym and they make sure we stretch really well before we work out. And I've noticed if I run in there late and I miss the stretch, every time I irritate something in my shoulder or somewhere. Yeah.
And I would say probably, if I had to put a percentage on it, 90% of the back pain I see is because people are tight.
Really?
Yeah. It doesn't matter to me what the MRI, people come into often, I've got an MRI, I've got 3 herniated discs. First of all, they're probably not herniated. They're just reading a report that a radiologist stated that it's a herniation.
Okay.
And their pain is back pain. And even a spine surgeon will tell you surgery for back pain doesn't often work.
Wow.
It's not as productive as if you have a shooting pain down the legs. That makes a lot more sense. And oftentimes I would say that almost 90% it's lack of flexibility.
Wow.
And then if you don't have a therapist who knows what they're doing to help that, doesn't know that they're not treating it, but they're not getting you further. And oftentimes I'll have to direct a therapist and say, look, you missed the flexibility. You've got the strengthening, great. You're working on the core, but if they're still tight, it's going to be tight. You need to do more than that.
Right.
And then when the patients do that, they come in with their eyes wide open. They're like, oh my God, that's so different.
Yeah. And it's so important that you direct that care because you're the one who's seeing the issue.
Mm-hmm.
That's what I've seen is so beautiful is in our community. I know this podcast will go everywhere, but in the South Florida community, it's so collegiate. You guys all work together, you refer, you discuss the patients. I love connecting all the alternative practitioners with the more allopathic traditional practitioners because then there's this synergy that's created where if you know the best trainer in your area, I'm more up in the north area, I'll connect my practitioners with my trainers and I'll say, look, when I have a problem, I'd love for you to pick up the phone and call him and tell him how he should be working me out and stretching me and rehabilitating me.
Yeah, that's very important.
Yeah. It's important to know who the best practitioners are and be able to direct that care.
Yeah. And I think as a practitioner, especially in the orthopedic world, it's important to try to get to know the therapists that are working on your patients because the majority of what we do is we send them to therapy.
Sure.
And any bad therapy can give you a bad outcome.
Right.
And I've had many times where I've had to switch facilities just because for whatever reason, patients had gone somewhere and just didn't get better.
Wow.
And so you find a place that works and all of a sudden they see a change and they notice a difference.
Nice. Yeah, because that's your outcome.
Well, yeah, our outcomes.
Your outcome's tied to that outcome.
Yeah, if I can't directly fix them with surgery or with an injection or something that I do in the office, my outcome really is going to depend on the therapist.
Sure.
And if the therapist doesn't do things appropriately, or they just go to a cookie cutter facility that just doesn't put them through more than what they need, patients come back and tell me they didn't do well.
Yeah.
And, then it's on me.
Yeah. And, to bring that home, I see that a lot. I see this mass produced aspect happening in medicine and in health in a way that I look at it and I'm like, we can't build a massage envy for PT and a massage envy for chiropractic. You can try, but if you're not going to bring in practitioners who've done this, who are seasoned, who do it with love and care and attention to detail, are you really going to be able to give that patient excellent care and get them to the result that they want? Like it takes a practitioner to spend time. You said there's psychology to it. So there's getting involved with the patient, getting involved with their care and convincing them that they are part of the solution. Yeah. There's no just here's a pill and you've got it and your problem is solved. It's more about how can I show you that if you make this change, you can get the result you want.
Yeah. And that's some of the tough part in today's medicine is trying to get patients to the appropriate, especially therapy or treatments, because, sometimes people think they have the greatest insurance in the world.
Yeah.
And it doesn't matter. There is no great insurance out there.
True.
I haven't seen one that'll pay the therapist because I think the therapists are also way underpaid for what they do because they spend a lot of time. And the good therapists end up being out of network because it's just they're able to spend more time with their patient and really give them the effort. There's a lot of other big facilities that they see volume, but that's just a business. And unfortunately, it's the only way to stay afloat. And oftentimes I have patients who complain, they're like, I went to therapy and I was one of 6 people in the room. I said, well, do you understand how much your therapist is getting paid?
Sure.
If you're trying to run a business, they need to see volume.
Right.
Or you can pay out of pocket and then you can do more one-on-one work. But then when you tell patients they have to pay out of pocket for healthcare, it's taboo.
Right.
They'll pay out of pocket for a lot of other things.
Yeah.
But when it comes to their own health, I've got insurance. And unfortunately, insurance doesn't cover it all.
Yeah, I don't look at my insurance as much more than catastrophic. It covers some stuff. But to me, optimal, vibrant health is a choice. And it's something you have to very consciously build in your life.
Yep.
And I don't assume that insurance is there for that in any way. If I get a surgery, thank you. Yep, I needed that level of coverage. That was going to be expensive. But outside of that, I don't consider it enough. I think our investment into health has to be tremendous nowadays, actually, for us to be able to keep our health and maintain our health, much less build vibrant, optimal health.
Yeah, you have to optimize yourself. I mean, that's the most important thing. But because if you don't, and you're expecting others to do it for you, that's the person that ends up being a couch potato because they're waiting for somebody else to fix them. And especially with musculoskeletal care, you have to be part of the solution. You just can't be the problem. Because if you can't motivate, if you don't listen to your physician, if you don't listen to the therapist and work on it, then it doesn't help. I oftentimes will tell patients, like, your insurance company is only going to cover maybe 2 visits a week with therapy. And I equate that to brushing your teeth twice a week. If you brush your teeth twice a week and think you're not going to get a cavity, it's not going to happen. You need to do it every day.
Right.
Now, it's difficult for us to do all the therapy regimen, but if I tell them, if you can do it 2 days in therapy and 2 days at home, that gives your body a day of rest in between to recover. Because recovery is big part of the process. And a lot of high-level athletes will tell you, one of the biggest things is bigger is the recovery than the actual training.
Wow.
Because if you don't recover well, then you won't heal. Because whenever you're trying to build muscle or do anything, healing is important.
Right.
And if you overstrain the system, that's when you get injured. So
absolutely.
Recovery, diet, nutrition, just sleep, health is very important. But if you are expecting others to do it for you, it doesn't work.
True. No, I love that summary. I love that you tell the patients about diet, nutrition, sleep. I would add reducing inflammation.
Well, that's 100%. It's part of it. And that's why I like, oftentimes, and I even carry information about Fusionary in my office because patients will be like, look, what else can I do that's not pills? And like we talked about earlier, and they're very happy, like, oh, this is something different. And like, well, I already take turmeric. I go, okay, great. Well, how do you take it?
Right.
Oh, I put it in my food. I go, great. So you've got food coloring.
Yes.
And it's got a little bit of flavor. And as I learned from you, it's more involved and there's different curcuminoids within the turmeric that we have to get. And that's why I tell them, look, you can go to GNC, Whole Foods, whichever facility, and they've got a wall, but we don't know what's in it. Right. And I don't know what's in each bottle. I can't tell you what's in each bottle. Because often they'll ask me, well, what do you think about this one? They'll show me a picture of some, their family member saw something in the newspaper. What do you think about this? I often say, look, it's like a nice advertisement. If you want to buy it, you can buy it. It's on you. Good thing is it's not a pill. So if it doesn't work, okay, you're out that money.
Sure.
But there's so many things out there. And I said, I can only discuss the ones that I do know and do understand. Yeah. Everything else, it's good luck.
Yeah, no, it's so true. And that's true in any area of health.
Yeah.
It's true with the practitioners we pick. It's true with the products we invest in. I'm all about medical grade turmeric and curcumin. I'm all about finding the most potent form of something that creates the most impact. And that's true in anything. I'm obsessed with all the supplements out there. I'm obsessed with water quality, air quality, food quality, and all the ways that we can prevent issues. And then if we can't prevent it and we need to go to a doctor to partner with on our health, okay, let's go. But let's go early on enough that we know our options.
Yeah.
And we don't wait till we're sedentary couch potato and haven't moved for 10 years and then go and discuss the options that we had at the beginning. And we just didn't realize what they were.
I think preventative care, and that's where a lot of the new integrative medicine and the world has kind of shifted a little bit, and people understanding that prevent issues. And I often talk about that, especially with young athletes. And I actually work with I have a referring pitching coach, because he heard me talk years ago, and I always said, look, send me your kids before they're injured.
Sure.
Because let's prevent an injury, because especially in baseball, you worry about Tommy John surgery, which is a tear of a ligament in the elbow, which we typically see in pitchers. And you're seeing it a lot more often. It's become almost an epidemic in youth baseball. 12-year-old, 13-year-olds undergoing major surgeries, which could be easily prevented.
Sure.
But the problem is, and in most areas, people don't know where to go to get that evaluated. So I always say, especially when I see somebody, parents who they come into for themselves, but they say, oh, my son's been having this surgery. I go, bring him in.
Of course.
Because let's prevent surgery. Because look, and I often say to my patients, look, my happy place is the operating room. Please make me unhappy. Because if I'm unhappy, that means we had a successful outcome without me having to do surgery.
Sure.
So I always say, keep me out of the OR and I'll be sad, but that means you did well.
Yeah.
And I put it on them.
That's a great way to say it. And I do think youth sports is a big deal. I'm a mother and my son plays soccer and I let him overtrain And I thought, oh, okay, well, I said, he's a kid, he'll recover. And then all of a sudden I ran to physical therapy with him because it was just not getting better. And I wanted him to go back to school. And PT said, you walked right up to the line. You were going to have to hospitalize this kid. I said, oh my God, he just wanted to train more. So I let him. And so it's just a powerful reminder of, just like we know there's preventive for our own joints.
Yep.
We need to invest in that or look at that time spent for the kids too. So that they're preventive and they're supporting the longevity. Like I've met enough orthopedics and chiropractic to know a lot of you guys were athletes for a very long time. And it's what got you into this.
Correct.
Because you needed to take care of yourselves well. And so I look at that and I think, wow, my children should not do any impact sports going through.
Well, if you do it the right way, I mean, I played sports for years. I didn't injure myself severely until I was already an adult.
Okay.
But it's about preventive. It's about working on your strength, working on your flexibility, and not overtraining, which is a big issue that we see in kids.
Sure.
Too many kids, especially here in South Florida. Yeah. They train year round.
Yeah, because you can. The weather's stunning. It's perfect.
And there's just a lot of pressure.
Yeah.
Lots of pressure. Because when I was a kid, I mean, we played soccer one season, played basketball another season, played baseball, and just altered. And that was great for the body because we're not always focusing on one thing.
Sure.
And summers were off.
Right.
You did whatever you did in the summer.
Right.
Nowadays, it's almost every sport's year round. Doesn't matter whether it's basketball, volleyball, soccer, football, flag football. It's become a year round thing. And that's where kids get injured.
Sure.
And there's more issues. So
that's a great reminder to push them to kind of have that variety and alternate and not let them just take a sport and run with just that one.
Yeah. We try to recommend, if you're going to specialize in a sport, not to do it till almost high school.
Okay.
Up before then, do a lot of different sports.
Wow. Yeah. Okay. Got it.
It's better for the body that way.
Got it. That's awesome. Thank you for that guidance. I feel like it's so important to hear from the experts on what you see. It's you who's seeing joint pain throughout the longevity of someone's life, youth, through our middle ages, through the elderly, through the very, very mature at the end. And so it's you who can kind of see that trajectory of what has worked, what hasn't, what the new trends are as we push people in youth sports in a new way, and what kind of those new novel approaches are. So thank you for coming on the podcast today.
My pleasure. Thank you for having me.
Yeah. And thank you everyone for listening to this episode. Please subscribe to it on Apple Podcasts and Spotify and wherever you listen to podcasts. And you can follow the Fusionary Health podcast on Instagram to learn more about everything that we're sharing here. So thank you so much.
You're welcome. Thank you.